In the previous video, we spoke about the effects of being on bed for a longer period of time on the human body. In this video, we will see how a caregiver can make the person's life better and make the patient more functional. In the next video, we will talk about when you should seek occupational therapist help and how occupational therapist will be able to help your patient who is on the bed. When I say bedridden patient, I mean both partially bedridden or completely bedridden. Partially bedridden meaning the patient may be able to move little bit, may be able to sit, but is not completely mobile on the bed and has to stay most of the time on the bed. Whereas completely bedridden means the patient has got inability to do any movement on the bed and is in the lying down position. So, the first thing the caretaker needs to learn and start caring of is the grooming aspect of the person. Grooming meaning giving patient proper bath, brushing his teeth, giving him a nail cut and taking care of his hair. While bathing, you have to take care that you are reaching all the areas of the body which the person is not able to reach, like the back of the neck, armpits, groin, the back of the buttock. So these are the areas where sweat tends to accumulate and microorganisms grow very easily. Another area which is often overlooked or not given much importance are the web spaces, the spaces between your fingers. These are the areas where organisms can target human body very easily. After bathing, let us talk about brushing the teeth. While brushing the teeth, you have to take care that you are reaching all the areas in the oral cavity. When I say oral cavity, I mean the mouth and the cavity inside the mouth. Clean the tongue, over and under the tongue, clean the palate very well. If the patient is not able to flush the water out, then you have to take cotton swab or gauze bag and clean his mouth thoroughly. So this was about the brushing aspect. Let us come to caring nails. When I say caring for nails, I mean you have to give him proper nail cut at regular intervals of time. Why this is important is because when the patient is on the bed, he has the tendency to scratch his body as and when the itching develops. So any kind of itching may cause injury to the skin. If the nails are longer than whatever length it should be, he will cause injury to the skin and there will be some red marks which may attract organisms and develop certain kind of infections. So you have to care for the nail. After that, we have to take care of the haircut and shaving. So depending on the patient's gender and whatever hair he has on his body, the rate of growth of hair, you have to set the frequency of shaving and of haircut. So give the patient proper haircut, brush his hair regularly, and regarding haircut, you have to set the frequency for haircut. After grooming aspect, let us come on hygiene part. When I say hygiene, it means keeping the microorganisms or infections away from the patient. You have to maintain the patient clean, no doubt about that. You have to also keep the surroundings clean. Linen or the bedsheet on which the patient is going to lie down for most of his time should be very clean. The bed should be clean, room should be clean. You have to maintain proper sanitation in the form of sanitizer or liquid soap wash besides patient's bed. Anyone entering in the room or visiting the patient should be asked to clean their hands and then visit the patient. This was about hygiene. Let us now talk about bedsores. So what are bedsores and how bedsores can be harmful to the patient, we have discussed in our previous video. So how to prevent bedsores? For that, patient needs to be turned or repositioned on the bed frequently. Avoid keeping patient in one position for any longer duration of time. Repositioning is one thing. Inspect for any reddening seen on the skin. You have to check patient's skin completely and see if there are any signs of redness or skin breakdown regularly. If you do this every day, well and good. If you do twice a day, then also it is good. There are certain areas in our body which are more prone for skin breakdown or bedsore development, like the bony prominences. This is one of the bony prominence. And over the ankles, over the heel, over the buttocks, over the elbow. So any position in which the patient is lying down for the maximum period of time, there results friction, and that rubbing or the friction may cause skin breakdown. After caring for bed sores, the next point that you should consider is the good nutritional intake for the patient. When I say good nutritional intake, why I am emphasizing this point is because the patient may not be able to eat as he was eating before having this illness. So you have to take care not to give him food like he was taking earlier, though that would be our ultimate goal. But then give him mashed food if he is not able to eat raw or uncooked food. Give him juices if he is finding it difficult to pass motion. It does not mean that completely stop the solid food, but if he is not able to take certain type of food, you have to substitute it with something so that body's nutritional level does not go down. Seek professionals' help. Consult your doctor, physician, or consult your dietitian or nutritionist for this purpose. But see to it that all the right amount of carbohydrate, protein, minerals, fats, and those things are entering in the body. After taking care of nutrition, let us talk about the comfort of the patient and the entertainment aspect for the patient. See, it is very difficult for the patient to be on the bed for all the time, and to imagine his life on the bed and not moving around and doing things that he was able to do earlier. So you have to understand this aspect of being on the bed for the patient. Once you know that, you will feel that inner urge to help the patient stay comfortable and motivated throughout the day. Make the room properly lit, properly arranged. The interiors should be according to patient's choice. The room should be well lit and enough of light should be there. It should be properly ventilated because fresh air will bring fresh energy for the patient. If the patient loves to watch TV, install a TV, give him remote control. If he loves to be in contact with people, then give him the phone. And if he is not able to hold the phone, then you'll have to make some arrangement for that. If he is a reader, you'll have to arrange the book and book reader. And these are the kind of arrangements. I have given some examples, but whatever is the patient's interest, those things should be included in that room, and that room should not lead to boredom for the patient. Eventually he is going to get bored, but if he is occupied and moving forward in his hobby, then the chances that he will break down or he will get bored decreases. After that, we will talk about the caregiver's aspect. This was all about patient, how to make patient happy and how to keep him functional, clean, and the other things. Now let us talk about the caregiver. This is an additional responsibility that caregiver is subjected to. So the caregiver has to accept that it is all right if he feels tired, if he doesn't want to serve the patient sometimes. And whatever guilt, anger, frustration the caregiver feels, he has to ventilate it out. He has to communicate it with someone. So the caregiver needs to have lot of patience. When I say having lot of patience means take care of your mental health so that you can take care of the mental health for the patient who is on the bed. So exercise patience, communicate well, ventilate your feeling. This is what the caregiver should do. If the caregiver is not knowing the right techniques of handling the patient, he will need some professional help, and for that he can consult occupational therapist. We will come on that aspect in our next video. So this was about how a caregiver should manage himself while caring for the patient. The other important thing that the caretaker will have to do is diaper management. If the patient is soiling in the linen or in the clothes, then diaper becomes mandatory. Sometimes patient is on the catheter. So all that thing goes on the caregiver. Caregiver will have to do these things for the patient. So you have to learn the proper techniques of diaper management, how to make the patient wear the diaper, remove the diaper, how to clean the patient without causing any discomfort to the patient and to the caregiver. So these are some minor or regular things which are to be done for the person who is on the bed. We will talk about the professional management, like what occupational therapist does for the patient who is on the bed in our next video. If you have any queries, if you want me to talk in details about anything else that the caregiver should know, I will include it in my video. This video was about generally how a person on the bed needs to be managed. But symptom specific or illness specific or diagnosis specific management we have not spoken about. We will talk about those whenever we will specifically talk about those diagnoses. Thank you.